And then, as Ambreen mentioned, I'm a big on social media. I'm also a big sports person, and I love my 49ers. You can see all around me. But these are I call the goats of sports. You may disagree with these goats here, and I'm a 49er fan, but I give Brady his credit. But no one's going to debate. These are the four therapies, the best therapies we have for heart failure with reduced ejection fraction, where the heart's not squeezing very well. So something called ARNIs or sacubitril valsartan or Entresto. You may have heard about that. Something called beta blockers, MRAs, and SGL2 inhibitors. These are the four so-called quad therapy. And we also have now therapy for the other type of heart failure where the heart's not relaxing normally. This is the first approved therapy in 30 years, just came out last year, something called SGL2 inhibitors, really amazing therapies. So as Nike says, just do it, right? All right, so this is kind of like my Instagram world, right? But we all know that Instagram versus reality is very different, right? So we have a vision of kind of how we see things, and then there's the reality, right? So what's the reality, right? So the real world treatment of heart failure with reduced ejection fraction. This is where the heart is not squeezing very well, and we have all these great therapies, the quad therapy that I'm being talked about, right? So this is actually patients admitted to the hospital for new onset heart failure with reduced ejection fraction. The heart's not squeezing very well. And out of that, basically, 4 out of 5 patients were eligible, 82% for these therapies, right? But despite that, only 1 in 6 prescribed it, right? We're not doing a good job. And you can see here the absolute risk reduction with all these therapies. So, and I really like this. This was someone I won't take credit for. This was someone on Twitter commented, time is years lost, right? Every time we see a patient, every time a patient touches some person's, whether it's a hospice or it's a nurse practitioner or a PA or a heart failure cardiologist or Ambreen or whoever it may be, that's an opportunity to change the trajectory of this patient, right? So we need to act at that time. Don't wait and don't push it off to the next person.